Hello everyone, in this video I will be administering vaginal installation. For every procedure, the first thing that I always need to do is to check the medication or the physician's order. Now that I have checked the physician's order, I'm going to obtain the medication ticket and compare it to the medication record or the physician's order. After comparing the two and knowing everything matches, now I'm ready to perform hand hygiene and wear gloves if it's necessary. And after checking the medication or the physician's order and performing hand hygiene and wearing gloves if necessary, I'm then ready to go to the patient with the materials that I need. The next thing to do is to introduce myself and to verify the client's name. Hello sir, I am Ashley Reyes and I'm your nurse for today. Can you state your full name please? Okay. And now I'm going to explain to the client the procedure. Now I'm going to explain to the client the procedure on what I'm going to do for him to cooperate. Do you have any questions? Okay, none. So let's start the procedure. In this part of the video, I will be administering vaginal installation. And now I'm going to ask the client if she wants to void. Do you want to go to the restroom, miss? Okay, now I'm going to assist the client on her back with her knees flexed and hips rotated laterally. Okay, ma'am, now I'm going to lie you onto your back. Now I'm going to place the waterproof drape under the bedpan. Now I'm going to clamp the tubing and hang the irrigating container on the IV pole so that the base is about 30 centimeters or 12 inches above the vagina. The thing to do is to run the fluid through the tubing and nozzle into the bedpan. Now I'm going to wear gloves and inspect the vaginal orifice for inflammation, and I'm going to note for any discharges or odor from the vagina, ask for any vaginal discomfort. Open your legs please, miss. And I'm going to check for any discharge or any odor at all. And I'm going to provide perennial care to remove microorganisms. Now I'm going to run some fluid over the perineal area. And then I'm going to insert the nozzle carefully into the vagina. I'm going to direct the nozzle into the sacrum, following the direction of the vagina. I'm going to insert the nozzle 3 to 7 centimeters or 3 to 4 inches. I'm going to start the flow and rotate the nozzle several times. I'm going to use all the irrigation solution, permitting to flow out into the bedpan. And then I'm going to remove the nozzle from the vagina. Then I'm going to assist the client in a sitting position onto the bedpan. To dry the perineum with tissues as required. And now I'm going to remove the bedpan. And I'm going to remove the moisture-resistant drape and pad. Now I'm going to apply a clean perineal pad and a T-bender if there is an excessive drainage. I'm also going to cover the patient. And now I'm going to assist the client into a comfortable position. Are you okay, ma'am? And do you have any questions? Okay. In this video, I will be administering vaginal installation. So since I don't have any materials or equipments that is used for vaginal installation, I am going to think of this syringe as an applicator, as my equipment. The next thing to do is to uncap the tube and unscrew it. Now I'm going to screw the applicator onto the tube. And now I'm going to pull the plunger onto the desired amount as prescribed by the physician's order. Today I'll be administering 1.5 cc of medication onto the patient. So now that I have 1 cc, now I'm going to unscrew the applicator off the tube, and I'm going to cap it again. Now I'm going to assess the client's knowledge of the drug and the procedure. And now I'm going to explain to the client the procedure and allow the client to ask questions. Okay? Okay. Now I'm going to assist the client onto a back lying position. Can you please lay on your back, ma'am? And flex the knees of the client. And can you please flex your knees? Okay. And the hips rotated laterally. Okay, now that's done. I'm going to assess the perineal area and clean it. After that, I'm going to change gloves. Now that I have changed my gloves, I am going to inspect the vaginal orifice for any inflammation, odor, or any discharge. We're also going to ask the client for any vaginal discomfort. And now I'm going to lubricate the applicator and expose the labia, expose the vaginal orifice by separating the labia with my non-dominant hand. And then I'm going to insert the applicator about 8 to 10 centimeters or 3 to 4 inches inside the vagina. Then I'm going to administer the medication. After administering the medication, I'm going to withdraw my applicator and then place it in a trash bin or any kind of disposal method. And then I'm going to throw away my gloves as well. And now I'm going to ask the client to remain in that position for 5 to 10 minutes. And the hips may also be elevated with a pillow. And now I'm going to ensure the client's comfort and dry the perineum with tissue as required. And I'm going to ask the client for any concerns and ask questions. Do you have any questions, ma'am, regarding the medication and the procedure? None? Do you need anything else? None? Okay. So I'll be right back. And every after procedure, the next thing to do is to document everything else, to do aftercare of the materials, to wash my hands as well, and to ensure the patient and check on her or him and for updates or for any changes regarding the response of the patient of the procedure. I'm going to chart the administration of the medication on the medication sheet after the drug has been administered. Thank you for watching.